Good morning, everyone. Thank you so much for joining us today. It's truly inspiring to be here with a group of individuals who care so deeply about the future of healthcare. Each of you has committed yourselves to making a difference in the lives of patients, and today we're going to talk about something that has the potential to amplify that difference profoundly: data-driven insights and the power of AI. We're all well aware of the challenges we face in healthcare: time constraints, the overwhelming need for documentation, the difficulty of seeing and acting on the full picture of a patient's health at any given moment. But imagine a world where data doesn't just overwhelm us, but actually works for us, where data isn't just stored, but actively supports every decision we make. Imagine a healthcare environment where AI and data-driven insights empower us to move from reactive care to truly proactive, preventive care. Today, we're going to explore exactly how data-driven AI is transforming healthcare, not only for us as healthcare providers, but also for the patients we serve. Because at its best, AI doesn't replace the nurse or the caregiver. It enhances our ability to provide thoughtful, compassionate, and impactful care. So let's start by talking about a fundamental shift that's happening right now. For decades, healthcare has been largely reactive. We respond to symptoms, we treat illnesses as they emerge, and we handle crises as they arise. But what if we could identify risks and intervene before symptoms even begin? What if we could look at a patient's data and not just see their history, but predict their future health needs? This is the power of data-driven insights. With AI, we can analyze vast amounts of data to identify patterns and trends that may not be immediately obvious. These predictive insights enable us to anticipate health issues, allowing us to act sooner, prevent complications, and ultimately improve patient outcomes. This isn't just about using data, it's about using data wisely to empower our decisions and transform our practice. Now, let's focus on how this power benefits nurses specifically. Nurses are at the front lines of healthcare. You are often the first to notice when a patient's condition is shifting, and you play a critical role in responding to those changes. But we all know that in a busy healthcare setting, keeping track of each patient's complex and evolving needs can be challenging. This is where data-driven AI can truly make a difference. Imagine an AI tool that monitors patient vitals in real time, sending an alert the moment it detects signs of potential deterioration. Imagine being able to step into a room and already have an understanding of which patients might need extra attention that day based on predictive insights. This is not about removing your intuition or your judgment, it's about enhancing it, giving you information that allows you to respond proactively and with confidence. One of the areas where this is happening already is in predictive analytics for early risk detection. We're seeing AI tools that can identify patients at risk for conditions like sepsis or heart failure hours, sometimes even days before symptoms become critical. With these tools, nurses have the chance to act early, prevent complications, and stabilize patients before they reach a crisis point. The difference? Fewer emergency interventions, lower ICU admissions, and more lives saved. This is data-driven care in action, and it's making an extraordinary difference. But it's not only about us as caregivers. This data also empowers our patients. Through personalized care planning and real-time monitoring, we're not just helping our patients live healthier lives, we're involving them actively in their own care journeys. When patients have access to insights about their own health, they become partners in the process. They understand their conditions better, they see the impact of lifestyle choices, and they become more committed to their own well-being. Take chronic disease management as an example. AI-driven data can help us craft personalized care plans for patients with diabetes, hypertension, or heart disease. Imagine a patient who can monitor their blood glucose trends, receive tailored advice based on that data, and work with you to adjust their lifestyle and treatment plan. This isn't just treating an illness, it's empowering patients to take control of their health, with you as their trusted guide. I want to share a few real-world examples of what this looks like in action. In one case, predictive analytics for sepsis detection helped the hospital catch early warning signs, allowing nurses to intervene before patients entered critical condition. As a result, ICU admissions dropped, recovery times improved, and patient outcomes soared. Another example comes from a facility that used AI to support personalized diabetes care. With real-time monitoring and AI-driven insights, nurses were able to create individualized plans, adjusting treatments based on each patient's unique patterns and responses. For these patients, it wasn't just about managing a disease, it was about regaining control over their lives and feeling supported every step of the way. And finally, let's talk about real-time monitoring for cardiac patients. In this scenario, AI systems monitored patients' heart rates and vitals continuously, flagging any signs of abnormality. For the nurses working with these patients, the benefit was immediate. They received alerts the moment changes occurred, allowing them to respond before a minor issue escalated into a major event. Now, as promising as this all sounds, we know there are challenges we must address. Data privacy and security are at the core of our ethical responsibility. With great power comes great responsibility, and as healthcare providers, we are entrusted with the most sensitive data. Every AI tool we use must adhere to the highest standards of security and transparency. This is where we, as advocates for our patients, play a critical role. We must ensure that AI serves our patients without compromising their trust. And of course, there's the challenge of data overload. In a world where information is at our fingertips, we must be selective, filtering out the noise and focusing on the insights that matter most. AI is a tool, but it is our responsibility to interpret its insights, using our judgment to deliver care that is data-informed yet human-centered. As we look to the future, I am excited by the possibilities that data-driven AI holds for us as healthcare providers and for the patients we serve. Imagine a healthcare system where we can predict and prevent illnesses before they occur, where patients are empowered to manage their health with our guidance, and where we, as nurses, are supported with real-time insights that allow us to focus on the human side of care. Nurses are essential in this journey. You are not just users of data, you are interpreters, advocates, and caregivers. Your insight, empathy, and clinical expertise are irreplaceable. The data we have is only as valuable as the care you deliver with it, and with AI as our ally, we have the power to bring proactive, personalized care to new heights. As we move through today's sessions, I encourage each of you to explore how these data-driven tools can fit into your own practices. Imagine the possibilities, ask questions, and think about how these technologies can serve you and, most importantly, your patients. Together, we can shape a future where data-driven care goes hand in hand with empathy, where AI enables us to deepen our impact, and where nurses and patients alike are empowered to take on healthcare's challenges with confidence and clarity. Thank you for being here today. Thank you for your commitment to excellence, and thank you for the extraordinary difference you make in every life you touch. Let's embrace this journey together and create a future of healthcare where data and compassion walk side by side. Thank you.